Cognitive challenges that are commonly reported from patients I work with. I've broken them down into 4 cognitive domains. The first domain is attention and processing of speech. Generally speaking, patients exhibit decreased ability to focus or attention, cognitive fatigue and overwhelm, and slowed processing. Next is language. Patients have difficulty with word finding, thought formulation, poor auditory comprehension, poor reading comprehension, and poor written comprehension. The third domain is memory. Generally speaking, patients have changes in short-term memory, changes in working memory, and problems with new learning. And the final domain is executive functioning. Generally speaking, patients have difficulty with planning and sequencing, organizing thought, time management, decision making, reasoning, problem solving, and multitasking.